Hi, my name is Alexa, and today I'm going to be talking about EHR, which is Electronic Health Records, and CQI. The history of EHR is electronic health records, are also known as EHR/EMR, which was first introduced in the late 1960s by Larry Weed. Mr. Weed introduced the concept of the problem-oriented medical record into medical practice. Weed's purpose for the electronic record was to allow a third party to independently verify the diagnosis provided by the physician. This is because before this introduction, physicians only recorded their own diagnosis as well as their treatment of care plan. Although providers thought of EHR as a great way to increase care for patients, nobody turned electronic until the 90s. The reason being is that EHR was too expensive as well as not fully trusted. Privacy. Since we are all studying healthcare, I'm sure you've heard of HIPAA. That is Health Insurance Portability and Accountability Act. The reason for HIPAA is to ensure patients that there is a law developed to keep their medical information safe and secure. Since EHR has been developed, it is proven that medical information is actually more secure. This is for reasons like access control. For example, that would be PIN numbers and password, which in turn helps to limit the patient's information. Audit trail, meaning that anyone that opens or changes information, a log will be kept electronically that will say who and when opened these records. Encrypting, your stored information. This means your health information cannot be read or understood except by someone who can decrypt it using a special key made available only to the authorized individuals. If, for some reason, your health information were ever accessed by someone other than an authorized personnel, the providing physician or company must report the breach of confidentiality to you as a patient. If you decide to take action of the breach, you can contact OCR. In case you have never heard, OCR is an organization created to help patients understand their rights and protection of medical health records. They are also open to help patients pursue legal action if a patient finds it necessary of a breach. Effectiveness of EHR. Electronic health records are more effective because they are easily accessible, cut down on medical errors, easier to interpret due to ineligibility of handwriting from physicians, and allow more time spent focusing on the patient's needs. For example, say you were a physician working at Southeastern Integrated Medical, where referrals are commonly distributed from one specialty physician to another. Example, referring for pulmonology to women's health. The EHR system makes this process so much easier by allowing the physician to access patient's chart immediately, avoiding the difficulty of dealing with old school paper charts. Another great asset to these electronic records have to offer is that we, as healthcare providers, can be notified automatically when a patient is due for an injection, medication refill, or even an annual exam. This great feature helps us stay up to date with the health of our patients, increasing our quality of care. What is CQI? CQI is also known as Continuous Quality Improvement. The purpose of CQI is to improve health care by identifying problems, implementing and monitoring corrective actions, and studying its effectiveness. This is an essential element to having health care because our purpose as healthcare providers is to ensure that we are providing the highest quality care as possible. CQI can be used to monitor high-risk, high-volume, or problem-prone aspects of healthcare. Since this can be such a broad topic, CQI is broken up into two different groups: CQI Process Study and CQI Outcome Study. The process study is designed to measure the effectiveness of the care delivered, while the outcome measures whether or not the expectations set by the patients were met. Although both studies have a different purpose, they should both identify a problem, conduct a study, develop and implement a plan, monitor, track results, and demonstrate improvement or restudy the problem. With all these regulations and expectations being met, any change implemented within a facility or organization should have a positive outcome. For example, the development of EHR. Conclusion. Seeing healthcare as a customer-served operation, there is always a place for improvement, hence why there is studies like CQI. But thanks to these type of operations, quality of care has increased tremendously over the years. In addition to CQI, electronic health records have also increased the quality of healthcare. This is because going electronic has increased the time spent focusing on the patient's needs, confidential information is more secure, and there are less medical errors. I say, let's keep moving forward with improvements because who knows how great we can get our healthcare system to be in the future. Thanks for listening, and I can't wait to hear your feedback.